Should I start? Bismillahirrahmanirrahim. My name is Dr. Meha Siddiqui, PG of Community Medicine Department, and today topic of my presentation is brucellosis. The quotation of the day is, health is like a money. We never have a true idea of its value until we lose it. Learning outlines are introduction, epidemiological triad, chain of transmission, levels of prevention, recent advances. Learning outcome, at the end of presentation, we'll be able to describe epidemiological triad, prevention aspects, and recent advances. So here is the introduction. Brucellosis is a zoonotic infection caused by the bacterial genus Brucella. Brucellosis was first diagnosed by Wright and Smith in 1897. People can get the disease when they are in contact with infected animals or animal products contaminated with the bacteria. Animals that are most commonly infected include sheep, cattle, goats, pigs, and dogs, among others. The other names for brucellosis are undulant fever, Malta, Gibraltar fever, Mediterranean fever. It is called undulant fever because it has waxing and waning pattern just like a wave. Then comes a problem statement. Brucellosis is a recognized public health problem with worldwide distribution. It is endemic wherever cattle, pigs, goats, and sheep are raised in large numbers. Important endemic areas for brucellosis exist in Mediterranean zones, Europe, Central Asia, Mexico, and South America. Eastern Mediterranean countries have experienced an increase in number of cases. The disease is now rare in most European countries, North America, and Australia. The prevalence of human brucellosis is difficult to estimate. Many cases remain undiagnosed either because they are inapparent or because physicians in many countries are unfamiliar with the disease. So here you can see that it is more common in the dark pink color shows that it is more common in Mediterranean zones, some areas of Europe and North America. Sorry, South America. And the blue color is showing that it is very, very rare, less than 2 per thousand population in North America and Australia. Then comes epidemiological triad. It consists of environment, host, agent. First comes agent factors. The agents are small, gram-negative, broad-shaped, non-motile, non-sporing, and intracellular coccobacilli of genus Brucella. Genus Brucella has 4 species that infect man, namely Brucella abortus. It causes abortion in the cattle. Brucella militensis. It causes infection in goats and sheep. Brucella susis causes infection in the pigs. Brucella canis causing infection in the dogs. Because they cause infection in these animals, so it is more prevalent in rural areas. Brucella militensis is the most pathogenic species. Other species are less virulent. You can see in this picture that these are the animals like goat, sheep, buffaloes. These are causing infection in men. Other species are not causing infection in man. Okay, then we come to reservoir. Man reservoirs of human infection are cattle, sheep, goats, buffaloes, dogs. Host factors. Human brucellosis is predominantly a disease of adult males. People at special risk because of occupational exposure are farmers, shepherds, butchers, veterinarians. Environmental factors, advanced domestication of animals with absence of hygiene, overcrowding of herds, high rainfall, lack of exposure to sunlight, unhygienic practices in milk and meat production. Its incubation period is highly variable, usually 1 to 3 weeks, but maybe as long as 6 months or more. Clinical features. Initial symptoms include fever, sweats, malaise, anorexia, headache, pain in muscles, joints, back, fatigue, depression. Some signs and symptoms may persist for longer periods of time, others may never go away or reoccur. These can include recurrent fevers, arthritis, swelling of testicle and scrotum areas, swelling of heart, and that is endocarditis, neurological symptoms, chronic fatigue, depression, swelling of the liver and spleen. Its complications are abscess formation, which is very rare. Two of the complications, that is Brucella endocarditis and neurobrucellosis. These two complications can lead to death. And in neurobrucellosis, the features are fever, headache, neck stiffness, positive MRI findings, conscious alteration, myelitis, vascular involvement, cranial nerve involvement. Transmission. There are three modes of transmission. First is foodborne, that is eating undercooked meat or consuming unpasteurized raw dairy products. The most common way to be infected is by eating or drinking unpasteurized raw dairy products. When sheep, goats, cows, or camels are infected, their milk becomes contaminated with the bacteria. If the milk from infected animals is not pasteurized, the infection will be transmitted to people who consume the milk or cheese products. Then comes airborne infection, breathing in the bacteria that cause brucellosis. Breathing in the bacteria that causes brucellosis may also lead to infection. This risk is generally greater for people in laboratories that work with the bacteria. In addition, slaughterhouse and meat packing employees have also been known to be exposed to the bacteria and ultimately become infected. Bacteria entering the body through skin wounds or mucous membranes, that is contact infection. Bacteria can also enter wounds in the skin, mucous membranes through contact with infected animals. This poses a problem for workers who have close contact with animals or animal excretions. Newborn animals, fetuses, and excretions that may result from birth. Those workers include slaughterhouse workers, meat packing, plant employees, veterinarians. People who hunt animals may also be at risk. When they are in come in contact with infected animals, exposure to the bacteria may occur through skin wounds, accidentally ingesting undercooked meat, inhaling the bacteria while dressing their game. Commonly infected animals include bison, elk, caribou, moose, and wild hogs. Okay, person to person spread of brucellosis is extremely rare. Infected mothers who are breastfeeding may transmit the infection to their infants. Sexual transmission has been rarely reported, while uncommon transmission may also occur via transplantation or blood transfusions. Risk of exposure. Occupational risk. People in certain occupations or settings may face increased exposure to the bacteria that cause brucellosis. These include slaughterhouse workers, meat packing employees, veterinarians, laboratory workers. Hunters' risk. Many animals can have brucellosis, and if you hunt certain kinds of wild animals, you may have an increased risk of brucellosis. This is because as a hunter, you may come into contact with the blood and organs of the animal you are hunting. Animals that can put hunters at risk are wild hogs, elk, bison, as we have discussed earlier. Risk for expecting mothers. Women who are pregnant and have been exposed to brucellosis should consult with their obstetrician health worker provider for evaluation. Laboratory tests and a short course of antibiotics, also known as post-exposure prophylaxis, may be recommended. Prompt diagnosis and treatment of brucellosis during pregnancy can be life-saving for the fetus, and cotrimazole is safe for pregnant mothers. While rare, human-to-human transmission from lactating mothers to their breastfed infants has been reported. Now, levels of prevention. Primary prevention, health promotion, specific protection. In health promotion, we give health education on avoiding consuming raw meat or unpasteurized milk, cheese, and ice cream, wearing gloves, protective glasses, and aprons when handling animals or animal tissues, covering any open wounds on your skin when coming in contact with animal blood, like during hunting of animals, wear protective clothing and gloves when helping animals give birth. In agriculture, work and meat processing, protective barriers and correct handling and disposal of afterbirths, animal carcasses and internal organs is an important prevention strategy. In labs, strict biosafety measures should be followed. Specific protection. The most effective prevention strategy is the elimination of infection in animals or slaughtering the unimmunized animals with full compensations paid to farmers. Vaccination of cattle, goats, and sheep is recommended in exotic areas with high prevalence rates. Its vaccine is live attenuated and falling are the strain 19 for Brucella bovis and strain Rev 1 for Brucella militensis. Nowadays, some effective vaccines are available to control the disease in cattle. S19 and RB51 are the officially approved Brucella bovis vaccine strains more widely and successfully used to prevent bovine brucellosis worldwide. The most widely used vaccine for the prevention of brucellosis in cattle is the Brucella abortus S19 vaccine, which remains the reference vaccine to which other vaccines are compared. Currently, there are no approved vaccines against human infection, and the use of animal vaccines in humans have serious drawbacks. Secondary prevention. Diagnosis is established by isolation of organisms from cultures of blood, bone marrow, exudates, and biopsy specimen during the acute phase of infection and by serological tests like ELISA and complement fixation. Now, WHO criteria, recommended criteria for diagnosis is, first of all, we'll look for its occupational history, traveling history. Then we'll come to clinical description, like as we have discussed earlier, its clinical features. After that, laboratory criteria, first of all, presumptive diagnosis comes in which we do a Rose Bengal test for screening. It is most widely used test for screening brucellosis. And positive test to be confirmed by one of, first of all, we'll do presumptive diagnosis, and if the test comes positive, then we'll go towards the confirmatory test. So presumptive diagnosis we do through Rose Bengal test and standard agglutination test. Confirmatory diagnosis, we do isolation of brucellosis species from blood or other clinical specimen. A presumptive laboratory diagnosis based on detection of agglutinating antibodies combined with detection of non-agglutinating antibodies to ELISA Coombs test. PCR and new rapid tests such as the lateral flow assay are yet to be accredited. Then comes case classification. We do this case classification humans, suspected case, a case that is compatible with the clinical description and is epidemiologically linked to suspected confirmed animal cases or contaminated animal products. And the probable cases that a suspected case with presumptive laboratory diagnosis, and confirmed cases a suspected or probable case with confirmatory laboratory diagnosis. Here is something about Rose Bengal screening test. It is one of the easiest methods to implement and most widely used for identifying brucellosis antibodies in sera. Principle of this test is it is a rapid slide agglutination test. It is now often widely used for diagnosing human disease. The test uses a suspension of B. abortus smooth cells stained with Rose Bengal dye pink color to detect Brucella agglutinins. The stained bacterial suspension agglutinates when mixed with samples containing specific IgG or IgM antibodies present in the patient sample. Now, if no agglutination takes, then it means that there is absence of specific antibodies. But if agglutination occurs, even slide, it means presence of specific antibodies. And after some specific time intervals, different ratios of antibodies is being shown. Patient history should be taken into account before giving the result. This test is a screening test only for the detection of Brucella agglutinins. If result is positive, it must be confirmed by other serological tests for brucellosis. Treatment. The WHO recommends the following for adults and children older than 8 years. Doxycycline 100 mg per oral BD and rifampin 600 to 900 per oral. Both drugs are to be given for 6 weeks. More convenient but probably increases the risk of relapse. So does doxycycline 100 mg per oral BD for 6 weeks and streptomycin 1 gram per day IM daily for 2 to 3 weeks. This regimen is believed to be more effective mainly in preventing relapse. Now we come to updates. According to one of the study, it is a disease of poverty. Infections of livestock have a huge socioeconomic cost. The figure of 500,000 new human cases each year is regularly cited in reviews and research papers. However, this is a vast underestimation. Many of the most affected countries do not have the infrastructure for diagnosis, and the broad spectrum of symptoms are shared with other febrile infections. In endemic areas, control of brucellosis is the first challenge. Vaccination programs need good vaccines. Two live vaccines, B. militansis Rev 1 and B. abortus S19, have been used over past decades with great success, proposed as a vaccine for bovine brucellosis. None of the available vaccines are perfect. They cause abortion in target and non-target animals and can be shed by immunized animals, and all can cause brucellosis in humans. RB51 is also resistant to rifampicin, one of the drugs of choice to treat human brucellosis. So we need new effective vaccines that are safe for both animals and humans. So there is currently an international call for development of a new brucellosis vaccine with a substantial price for the first new vaccine. Then this surveillance was done in 2010 in US, and according to it, highest number of brucellosis cases, 56% was reported by California, Texas, Arizona, and Florida. Now, dairy herds in the USA are tested at least once a year to be certified brucellosis free with the Brucella milk ring test. Cows confirmed to be infected are often killed. In the US, veterinarians are required to vaccinate all young stock to further reduce the chance of zoonotic transmission. This vaccination is usually referred to as calf foot vaccination. Most cattle receive a tattoo in one of their ears, serving as proof of their vaccination status. This tattoo also includes the last digit of the year they were born. And recently, last year in 2020, an outbreak infecting humans took place in China after the Lanzhou biopharmaceutical plant, which was involved in vaccine production, accidentally pumped out the bacteria into atmosphere and exhaust air due to use of expired disinfectant. So outbreak affected over 6,000 people. Now we come to MCQ session. The most pathogenic Brucella species for man is
Militant.
yes, because others are less virulent. Brucellosis is an enzootic disease caused by bacteria Brucella. Which of the following is true about it? A. Its incubation period ranges from 10 to 14 days. B. It's made by virus mosquito. C. Person to person transmission is yes. Because
That's
its
right.
incubation period is highly variable, and as you know, main reservoir are cat, goat, buffalo, and person to person transmission is rare. Brucella abortus causes abortion in pigs, sheep, cattle, dogs. Yes, right, it's cattle. Important endemic areas for brucellosis exist in Mediterranean countries, Russian countries, North America,
Mediterranean.
yes, because it is almost eradicated in the rest of the countries. People at special risk because of occupational exposure are butchers because they are in direct contact with animal products. Brucella is gram-positive bacteria, facultative bacteria. Yes, it's gram-negative bacteria. A 45-year-old farmer came with symptoms of recurrent fever and arthritis. On examination, there is enlargement because as the scenario shows, it's farmer and the fever was Brucella. Which of the following vaccine is commonly used to control the infection in young animals? It's A. Okay. Type of vaccine for brucellosis is live attenuated. Okay. The most widely used screening test for brucellosis. Yes, right.
Okay, thank you very much, Dr. Meha. Are you with me?
Yes, ma'am.
Right. This is a good presentation as you have presented for the first time. So I will not make a very critical remarks about it, because being a presenter for the first time, your errors are much lesser as I expected. So wonderful presentation. However, please go to your MCQ number 8, please.
Yes, ma'am.
Do you think this is a good MCQ?
No.
In MCQs, we want the answers to be very near to the correct answer, and actually they are not wrong answers. We have to choose the best one. Do you
Okay.
tell me how the rest of the answers, they are correct answers?
No, they are not correct.
Like, it is not possible that vaccine is not available, so it is a useless option. Similarly,
Okay.
we always want distractors that are very close to the correct answer, and they are also correct themselves. It is not possible that they are absolutely wrong. So this MCQ is absolutely wrong, right? The
Okay.
second important thing is, please let me know what are the important areas where brucellosis is common in Pakistan. I am really looking forward to the areas that are very commonly having the cases of brucellosis in Pakistan, because
Uh,
in presentation
okay.
you have seen that I have said that the most emphasis should not be on where this disease is present all over the world, but more emphasis should be laid on where it is present in Pakistan. So brucellosis, yes, it is a very common disease. It is very near to tuberculosis, and its signs and symptoms, as you have presented, they are very close to tuberculosis. So what are the areas where it is endemic?
In Pakistan, in central Punjab, but I didn't get any authentic data about human brucellosis. But in
There are
animals,
so many research papers that are available, and you must first read your
okay,
papers before giving such a strong statement, because this statement is not only strong, but it is not correct. That in Pakistan, you have to read the papers. It is very common in Punjab, in Sindh, not only in central Punjab, but also in other areas of Punjab, especially South Punjab. So your answer is absolutely, again, I'm sorry to say, it is incorrect.
okay,
Absolutely incorrect. You have not read it even. So I would like you to please read it again and present
okay,
me a
ma'am.
map, right? You have to send me a map of
Okay,
Pakistan, where the disease of brucellosis is very common, and it has been well reported in literature as well as in research. Now,
okay.
my second question is, what are the different preventive steps? And would you please sum it up in 3 important steps?
Yes, ma'am.
I want specific protection, right?
Yes, yes.
Level 2 prevention. You have to sum up the level 2 prevention or specific protection for the disease of brucellosis.
Ma'am, first of all, we survey about the animals, their status. Then, if they are unvaccinated and there are not available services for vaccination, then we slaughter the animals, and then we go for vaccination of the animals.
So everything is for animals, nothing for humans.
Um,
Do you get my point? Your specific protection is highly incorrect. Whenever you are giving specific protection of any zoonotic diseases, you have to cover 2 important aspects. One is the animals, and the second is the humans. So what
yes,
would be the humans and how the specific protection would be offered to humans? You are not a veterinary
ma'am,
doctor. You are a doctor that is giving the advice to the community or humans. So what would be your advice?
ma'am, foods about food safety measures and occupational hygiene,
And
early
what else?
diagnosis. And early diagnosis
Early diagnosis and prompt treatment
and
is the
prompt
part
treatment.
of G is the part of your either
Secondary.
it is a part of special protection. Is it the part of second
No,
level of
no, no,
prevention?
no.
Meha, this is something I want to stress again that whenever we talk about 5 levels of prevention, we should be very clear that the first level is about health education and awareness. The second is about specific protection. The third is about early diagnosis and prompt treatment. I am asking you the second level. So I think you again have to make a slide about the second prevention and
Okay.
incorporate the human aspect along with the animal aspect. And please, I will check it and then I will let you know. Thank you very much. If
Thank,
anybody has any
thank you,
question,
ma'am.
please do ask.
Okay, thank you.
Okay, thank you very much. Allah Hafiz.
Allah Hafiz.